Okay, our next speaker is Dr. Epstein, medical legal review of cases involving quadriplegia following cervical spine surgery, an argument for a no-fault system. Dr. Epstein.
Thank you. I'm going to ask one major question today, and that is, are all patients who become quadriplegic following cervical spine surgery adequately compensated by our present medical legal system? And I'm going to try to show you that the answer is no. In order to do this, I utilized a legal journal called Verdict Search. It reviews major verdicts and settlements involving criminal and civil actions. I focused on medical malpractice, and for the search engine, I utilized cervical surgery and quadriplegia. With this, I identified 54 suits involving patients who were quadriplegic following cervical spine surgery over a 20-year period. Many of the patients enjoyed substantial reimbursement. However, there were many others who did not. And that's the point of this talk. Well, what were the venue for the suits? In other words, the states that were involved. There were 18 of these suits that came from California, 14 from New York, 4 were from Florida, and 18 from the remaining states, for a total of 54. The operations performed included 25 anterior procedures. What was interesting is that 18 of these were just single-level anterior discectomy infusions. 22 cases were posterior operations, 16 were laminectomies alone, and 6 involved posterior fusions. One was a circumferential procedure done at the C6-7 level, and in 6 cases, there was not enough information to exactly identify what type of operative procedure was conducted. Patients averaged only 46 years of age. There was an enormous range of 5 to 82, but nevertheless, many of these patients were quite young. There was a 2-to-1 male to female ratio, 36 males and 18 females involved in the study. So we asked 4 questions. The first was, who was sued? Well, in 44 of the 54 cases, spine surgeons were involved in the suits. They were involved alone or in their group in 15. They were involved with hospitals in 13. They were involved with hospitals and other physicians in 12. They were involved with other physicians in 3. And in one case, they involved residents and chiropractors. And uniformly, when I spoke to residents about this, they were in a state of unbelievable shock. But in 10 of those 54 cases, spine surgeons were not involved. In one case, it involved other physicians alone. In 8 other physicians in hospitals, by the way, most of these were emergency room physicians. And in one case, it involved other physicians and a bus company. The next question was, what were the 4 most common allegations leading to suits? And these included negligent surgery in 47, failure to diagnose and treat in 33, and lack of informed consent in 23. Now, these 3 are very common factors in almost any surgical suit. But what was unique to cervical surgery was the failure to brace in at least 15 of these cases. And to further inform you, I just want to tell you what some of the other allegations were that led to suits. One that was prominent was, in 6 cases, failure to study postoperatively. These patients were quadriplegic following surgery, yet no postoperative MR or CT evaluations were performed to delineate why they were quadriplegic following these procedures. There were 3 cases of failure to place in a postoperative monitored unit. These patients were found hypoxic, nearly dead in bed, many of them ending up in ultimate comas. There were anesthetic complications in 3 cases, and failure to perform intraoperative SCP monitoring in 2. Other allegations, failure to disclose that they were non-FDA approved devices, particularly posterior cervical screws being employed where the patients were not informed that these were not approved by the FDA. 2 cases of cerebrospinal fluid fistulas in patients with unrecognized OPLL. The OPLL was not recognized because no preoperative CT scans were performed to supplement those MR studies. Had they been done, it would have demonstrated that OPLL did indeed go to and through the dura. Misplaced screws in the disc space. It was documented that the screws were in the disc space. Patients were never informed of this. The graft and plate extruded. The patients became quadriplegic, and that's what helped prompt these suits. And obviously, as we've spoken about today, another 2 cases of wrong level surgery. The next question, the third, was how long did patients have to wait for verdicts or settlements to be rendered? And the average period was 4.3 years. But I'm going to have you look and focus just at the average years here first. The average years for a settlement was 2.8 years. The average for the plaintiff's verdict was 3.2 years. But look at this. The defense verdicts almost took twice as long at 5.6 years. And then let me also have you pay attention to this side of the slide here, where you look at the range. The range in settlements, plaintiff's verdicts, and defense verdicts began at 1 to 2 years, but in the latter 2 extended over 11 years. That's a tremendous period of time. And when people heard this, the first question they asked was, were these patients even still alive? The final, and I think the most important question is, what were the outcomes? In terms of the plaintiff's verdicts, there were 19 plaintiff's verdicts, nearly $6 million. But look at this tremendous range, $540,000 to well over $18 million. What were the settlements? Well, there were 20 settlements, and here, $2.8 million, less than half of that for the plaintiffs. And the settlement range, again, staggering from $66,500 to over $12 million. And finally, and most importantly, is what were the defense verdicts? There were 15 of these, and these 15 patients, they received absolutely nothing. I'm going to give you 4 examples of just how arbitrary our medical legal system can be. And it really is a coin toss. Heads, the patient wins. Tails, the patient loses. First case is from New York in 2005. This was a 67-year-old male. He had bilateral arm pain. He was diagnosed as having cervical stenosis and underwent a laminectomy. Postoperatively, he was quadriplegic. And the allegations included negligent surgery, which you're going to see again and again, and failure to utilize intraoperative SEP monitoring. In this case, a neurosurgeon was sued, and I'm going to ask you with a show of hands, was this a defense verdict or a plaintiff verdict? Let's start with a plaintiff verdict. Okay, defense verdict? Okay. And in this case, indeed, it was a defense verdict. The patient got nothing. In the next case, this was a different venue, the state of Florida, in 2002. An 82-year-old female who happened to be a housekeeper had some left arm weakness, diagnosed with cervical stenosis. She underwent a laminectomy. Same scenario. Postoperatively was quadriplegic. Allegations nearly identical. Negligent surgery, in this case, also including lack of informed consent. And in this situation, a spine surgeon was sued, and that basically meant it was an orthopedist. Show of hands. Defense verdict. Show of hands. Plaintiff's verdict. Okay, you're right. It was a plaintiff's verdict of $1.4 million. But you look at these 2 cases and you say, well, what's the difference between the 2? Except the younger patient did not get any reimbursement. Okay. Let's go from posterior surgery to anterior surgery. And making that switch, let's look at New Jersey in 2002. A 54-year-old male, severe neck pain, but danced at a wedding 10 days before. The patient underwent an anterior corpectomy infusion, multi-level, C4 to 7 with plating. And by the way, this case was done by a very well-known member of the society. Okay, postoperatively, the patient was quadriplegic. And what were the allegations? Again, uniformly, we're seeing negligent surgery. And here, SEP monitoring was performed, but for over an hour after having placed a graft in, nothing was done. The graft was finally removed. The SEPs very minimally returned, but that patient remained quadriplegic. In this case, the neurosurgeon and the hospital were sued. Show of hands. Plaintiff's verdict? Defense verdict? Okay, so you're right. This was a plaintiff's verdict for $5.2 million, and the neurosurgeon paid $3 million of that. And in the final case, this is California in 2003. The 52-year-old female complaining of numbness in the arms and legs underwent an upper-level corpectomy for OPLL from C2 to 4. Well, she woke up not only quadriplegic, but also was respirator dependent. In this case, claims and allegations, negligent surgery, we've now gone 4 for 4. And lack of informed consent, well, that's 2 out of the 4. And again, a spine surgeon was sued, in this case an orthopedist. Plaintiff's verdicts, hands up. Defense verdicts. Okay, that's kind of even in the audience. Well, in this case, in the state of California, they got nothing. So in summary, the current system really fails to compensate many truly injured patients. In this case, we had 15 defense verdicts rendered for patients who were quadriplegic. They got absolutely nothing. In addition to that, it takes a long time for these things to come to pass. This current system is very slow, and it took an average of 4.3 years to come to a decision, and in some cases they had to wait over 11 years. Alternatively, in a no-fault system, patients would receive reasonable compensation over a reasonable period of time. The countries that have no-fault systems include the Nordic countries, Norway, Sweden, Denmark, Finland, and also New Zealand. In fact, if you live in Sweden and you've been in some way wronged, you go into that clinic, your surgeon or your medical personnel will help you fill out that form, and 40% of you will be reimbursed over a 6-month period of time. Perhaps, though, more readily and more importantly, if you have a no-fault system, all efforts are focused on remediating or reducing future adverse events, as opposed to our present system, where the greatest emphasis is placed on obfuscation, or basically hiding things under the nearest rug. So in conclusion, the present malpractice system does not work. It does not work for the patient, particularly the one who gets no compensation. It does not work for us as surgeons, much less our other colleagues as physicians in other fields. There's only one group this works for, and it only works for the lawyers. Thank you.
I'd like to open the floor for a question.
I don't quite understand why. Clearly, patients can be injured through in surgery without negligence, and so my sense, and maybe I misinterpreted your article, but I'm not sure that patients are entitled to compensation for an adverse outcome that was not a result of negligence.
I think that is a question. Let me just back up and let me give you just some background as to why I do the study, which may explain some of that. The motivation for doing the study is, if you look at what is the accepted risk of quadriplegia following any operation, cervical spine, and you try to go to the spine literature, you're not going to find those data there. And if you go to the medical-legal, because they're discoverable, and you're not getting everybody, like maybe the new future system of acquiring these data may show that. But if you go to the medical-legal literature, you're going to find a lot of these cases. And if you read through the cases, and the cases that I read through, there was negligence in these cases. The surgeons were at fault in these cases. I eliminated the cases where the surgeon was not at fault at all.
All right, great.